I am Dr. Brent Viray. I serve as an academic rural surgeon in a provincial hospital in Balera, Aurora. I am an emerging voice that hopes to shorten the gap in surgical service delivery inequity, bias for the disadvantaged and marginalized patients. Right after graduating from medical school, I volunteered as a Doctor to the Barrio or DTTB, a physician deployment program of the Department of Health to serve in doctorless far-flung municipalities in the Philippines. Current with this work was the completion of my master's degree in public management, major in health system development, and upon completion, I was awarded the highest academic distinction of the class, best thesis, and one of the best DTTBs of the batch. Global health issues and health equity are very close to my heart. I worked and still working firsthand with my countrymen who are devoid of health rights, especially in surgical care, particularly in surgery. During the tail end of my general surgery training, I co-created the rural surgery program of the Philippine General Hospital. The program's objective is to make quality and safe surgical care accessible to the marginalized and the poor. The program was successfully implemented in a municipality level and is now upscaled to a provincial level in Batangas. Last July 2023, I launched the Basic PH program. Basic PH stands for Basic Surgical Intervention Course for the Primary Healthcare Workers. The program's objective is to surgically capacitate the frontline health workers to recognize, to assess, to temporize, and to effectively refer surgical patients in the first contact of care up to secondary or tertiary level of care. My recent works incorporates health equity in certain levels. Last May, I presented a poster in the World Congress on Public Health entitled Defining Rural Surgery, a Philippine Perspective. As a medical school professor in 2 universities, there is a very strong urge for me to inspire my students to imbibe a biopsychosocial approach in treating their future patients. I believe that service for the poor should not be poor service. Last 2015, I was invited to be a public health intern in an international non-government organization, the International Community for the Relief of Starvation and Suffering in Nairobi, Kenya. During the same year, I also became one of the Philippine representatives for the Global Health Course in Nepal. Last September 2020, I unfortunately suffered from a massive hemorrhagic stroke. During my recovery, I vowed to use my gifts for the wellness of my surgical patients. I am currently managing a segment in our local radio station that hopes to increase the surgical literacy to my townspeople. Again, this is Dr. Brent Viray, your surgeon on duty and your surgeon at your service. I dream that someday there will be no Filipinos surgically left behind.